Meanwhile, the National Health Department is on high alert for a looming third wave of COVID-19 infections. But what are the requirements to determine the country has indeed reached that level of the third wave? Joining us to explain this is the Deputy President for Research at the South African Medical Research Council, Professor Jeffrey Mphahlele. Prof, a very good morning to you. Also, the viewers would know that you do serve on the Ministerial Advisory Committee with respect to vaccines. Let's start with where we are as a country, Prof. If you look at the infection rate, you couple that with the positivity rate, where are we as a country? Are we effectively in a third wave?
Thanks, Tony, for having me. So I think it is definitely a stage, if you look at the number of cases, where everybody in that question, are we in the third wave, or these are just the signs that we might likely get into the third wave. And I like to believe that as we approach winter, these are probably the signs that we are probably heading towards the third wave.
Yeah.
There is a strong likelihood that we will have the third wave, and I'm basing this on the fact that most countries have actually experienced the third wave. So we should never ever think as a country that we will never go through the third wave.
Yeah.
But as we speak, I don't really think that the number of cases that we see nationally justify the definition of the third wave.
All right. Someone actually commented in an article that I was reading this morning, and they said, I guess to emphasize their point, that we effectively are edging closer to a third wave, if not in it already. They said that the cases that you see now, they are not going to go down. Is that your view as well?
Yes, most likely the cases will not go down. They will continue escalating. We just don't know the rate at which they will escalate. We might be lucky that the third wave is not severe, but nobody can predict with 100% certainty how severe the third wave is going to be. I think the most important thing is how we behave to try and mitigate the third wave. So, yes, I think the cases definitely are signaling the third wave, but as I said, one can really not say at this stage that we are officially, in the third wave as a country.
Okay.
Perhaps some provinces could talk about the third wave looking at the number of cases, but nationally, I don't think we are.
Prof, looking then at the situation that is playing itself out outside one of the vaccination sites, that's the Charlotte Maxeke Academic Hospital, that's where some of the health workers in the Gauteng province who are yet to be vaccinated, they've been queuing there since yesterday. They were turned back to say, return today. Today they're told again, come back tomorrow. If you look at that situation and you want to also look ahead to the elderly population, 60 years and above, we understand that vaccination of the elderly population, it starts on Monday. Are we prepared as a country to carry out this vaccination program?
I'm going to give you the answer that I've given before. I like to believe that the vaccination centers that have been used during the implementation study of Sisonke should be prepared really to roll out the vaccination program without major glitches. The problem here, or maybe the only thing here, is that obviously there will not be the research team to assist the health officials. So everything will be handled by the health officials, but at this stage, because the health officials were part of the Sisonke teams, they should be able to know what to do. I like to believe that actually nationwide training programs have been conducted, so most healthcare workers should be prepared and should be able to know what to do. But that said, if you have got a new vaccination center, most likely you might find some minor glitches during the first week of the rolling out of the vaccination program. But these glitches should not be insurmountable to start with, and is something that you would expect with introducing any new program. The most important thing would be that the glitches are resolved, if there are any glitches, and as many people as possible will receive the vaccine.
Prof, why are we still talking about glitches? And we are now in a we're possibly in a third wave or going into a third wave as a country. This pandemic, it hit us in March of last year. We have had adequate time to prepare, many will argue. Why in the world are health authorities still talking about glitches in terms of the vaccination drive, which we were late to implement to begin with?
Yeah, so this is my hypothesis, totally. So it could be that there are no glitches. But the reason I'm saying we could see minor glitches is because the COVID-19 vaccination program is not like the usual, childhood immunization program, because you will know that for the childhood immunization program, this is well established, is given in the clinics, and healthcare workers know what to do, and they've been trained and they've been administering these vaccines for a long time. With COVID-19 vaccination, you have got number of stakeholders and players. So it's not just going to be the clinics. So we're talking about the hospitals, we're talking about the public sector, the private sector, we're talking about the new players in the field. So all that combined, obviously you can't expect that every vaccination center will just run smoothly. But it's not about handling the pandemic in this case. It's about delivering the vaccine. So these are two distinct issues.
Prof, can I make my argument perhaps slightly more crystal clear? So you have healthcare workers who are complaining bitterly outside Charlotte Maxeke Academic Hospital that they're being played for fools in terms of them being vaccinated or getting their vaccines. You also have a situation that's playing itself out outside the St. Augustine's Hospital. That's in KZN. There are reports of snaking queues there. Healthcare workers, again, who have not been vaccinated, were waiting for vaccines. I put it to you, Prof, that the health department is on the verge of either failing these health workers who are in the front line of this, and in all probability, we are going to see the elderly population that is scheduled to be vaccinated next week probably infecting each other in these long snaking queues with their immune systems already compromised.
Look, that remains a possibility, and unfortunately what is happening at Charlotte Maxeke and other places is regrettable, but I know the case of Charlotte Maxeke because obviously is exacerbated by the fire that was there some weeks ago, and I think for the national rollout program which starts on Monday, definitely there will be some of these glitches as I mentioned, but then we just have to make sure that we help as a community. I was talking to one of the reporters the other day to say that when we look at the number of people who are registered in the system, and we worry that maybe, the numbers are not high enough. And quite frankly, they are not high enough because not all pensioners can actually do registration for themselves. So we need to assist as the community. If I've got a mother or a father, who is a pensioner, and I can help with the registration process, I should do that. And then if they are due for vaccination and I am available to help them, I should take them to the vaccination centers and assist them to get the vaccine. So we should not just let them go alone. And obviously, these are the elders, and we just don't want them to go through this trauma of queuing for the whole day without any assistance.
Professor Mphahlele, I put it to you that we are not only failing the healthcare workers, but in all probability, we're going to fail the elderly population. But I want us to continue this conversation in a moment. Very good morning to you once again. If you're just joining us, we are in conversation with the Deputy President of the South African Medical Research Council, Professor Jeffrey Mphahlele, who also is a participant in the Ministerial Advisory Committee on Vaccines. Prof, can I tell you a response that's just come through from our team here? This is all in an effort to try and find out what the issue is specific to Charlotte Maxeke vaccination site where health workers are queuing outside. So we asked the question of the Department of Health, what's going on at the hospital, and the response from the department is that the hospital must respond. The hospital then says to us, no, the Medical Research Council must respond. You are the Deputy President of the Medical Research Council, so we are seeking your response as to why is there a mess outside Charlotte Maxeke Academic Hospital?
Yeah, unfortunately, I don't have an answer that would be straightforward. I think the issue is complicated. But as far as I'm aware, is actually complicated by the fact that the processes were actually affected by the fire that was there some weeks ago, and obviously getting back to normal takes time, and we also know that nationally the Sisonge implementation trial was affected by the problem of the blood clotting because the study was paused for 2 weeks. And all these factors are playing out, but clearly the other vaccination centers are operating, and there are just few which continue to experience problems. And the Charlotte Maxeke one is, for me, really, it is really an issue that for me is complicated by the problem of the fire that broke out in that place. So it could be that there are other problems that I'm not aware of, and I don't want to refute that. But as far as I'm aware, that is actually the primary issue.
Professor, I want to move on from the discussion around the vaccination of the remaining healthcare workers. So far, we know that the country has vaccinated 400,000. If we are failing to vaccinate the remaining ones, the elderly population, if they're going to experience the exact same thing that is being experienced by healthcare workers, then we are in a mess, Professor. Why is it that the department could not visit the elderly population in their homes? The UK did that, and I think they did that successfully.
Yeah, unfortunately, I can't answer on behalf of the National Department of Health. I like to believe that there will be exceptional cases where they will require vaccination, maybe at home, and I'm sure the Department of Health will reach out, but to increase the pace of vaccination. Those who are able to go to the vaccination sites, I think it will be better if they go there to get their vaccine. And those who need assistance, as I mentioned earlier, we as the community, we should try and assist them to take them to the vaccination sites. So in my head, I like to believe that we all have a role to play. So we should not leave everything in the hands of the National Department of Health. Because if we do, obviously, the resources are not like limitless. They can do so much, but as the community, we need to step in and help, to get the vaccination drive going.
All right, Professor Mphahlele, let's end our conversation very quickly. The element about the elderly being vaccinated, possibly, is going to be responded to by Phumla Williams, whom I'm told is standing by, who's going to speak on behalf of government. Very quickly, Prof, ivermectin. AfriForum is saying that SAPRA and the health authorities in the country, they are refusing to recognize it officially as part of the regimen, if you like, in treating COVID-19. What's the hesitancy about?
Well, as far as I know, I think it's still about looking at the efficacy, not very much about the safety, but the efficacy of ivermectin as a treatment for COVID-19. So at this stage, I know that there has been some studies for ivermectin as a treatment, and there were also some studies which were not quite convinced that ivermectin should be touted as a treatment for COVID-19. So it's still something that is not totally discounted as a treatment. I would say that studies are still looking at ivermectin, and at this stage, really, it's not recognized as official treatment for COVID-19.
Professor Jeffrey Mphahlele, thank you very much for your time. He's the Deputy President for the South African Medical Research Council, also is on that panel that is advising the Health Department on vaccines. Thanks indeed.